Kia ora tātou. My name is Tanya Pedersen, and this is the fourth video in a series from my presentation for Altogether Autism and Parent to Parent. So this one is about meltdowns and shutdowns and follows on from my previous one about sensory differences. Now, this also can be applied to any person who has hit critical mass, and this could be due to grief or anxiety or anything that has made the system overload. So first I want to point out that meltdowns and shutdowns are a medical event, not a behavioural decision. And sometimes no amount of anything will prevent a meltdown. So I want to present a formula, an idea of a formula that I've found helpful when this happens. And I will say that some explosive meltdowns need a different approach. So wherever possible, allowing someone to have a safe space is always preferred over physical restraint. So a broken vase is worth a whole lot less than a broken spirit. Regardless, what I'm going to talk about next can be used once aggression has reduced if an explosion has occurred. So, overwhelmed senses, misunderstandings, social pressure, hormones, and not getting physical needs met in diet, sleep, and exercise can all lead to meltdowns and shutdowns. This is not a tantrum, it's not a choice. This can be the most painful and embarrassing thing to experience. I experienced both meltdowns and shutdowns, and they're scary. No matter how much your mind is trying to talk you down, it is like you're on a fair ride and you have no choice except to continue the ride until the very end. So here's a thing I made up to help you to keep safe and recover yourself or the person you care for from a meltdown and shutdown. I purposely used the RICE, an acronym, seeing as we are describing a medical event and how to manage it. The usual RICE: rest, ice, compression, elevation. So, reassure. I am here. You will be okay soon. This acknowledges that they're not okay now, but reminds them that they'll be okay in time. This reinforces how they're feeling, and it doesn't minimize it. For example, if you were to say, "It's okay, you were fine," the voice in the head will be screaming, "I am not even fine," and can escalate the feelings that they're having. Isolate or incubate. So take them to a quiet, comfortable place, or if that isn't possible, clear or secure a space around them to reduce the sensory input and make them feel safe. C. Cares. Check that the basic needs are being met. Either keep the person warm, wrap them like a hug, or cool them down, depending on their needs at the time. So offer water and a wet face cloth, and leave these within easy arm's reach. At one of Sulaki's talks that I went to, she mentioned that drinking with a straw can be beneficial to help calm someone down. This may be to do with using the jaw muscles, and if you unclench your jaw muscles, your whole body tends to relax. And a heavy blanket can be a great tool for calming someone who has hit overload also. Earshot. So stay close, but not in your face close. Stay distant visually, but within the hearing area, in case the person is ready to say some words. Leaving someone alone, but within a safe distance, can be especially helpful if this meltdown has occurred in public or around people. So isolate them into a safe space, then give them space. They may be feeling embarrassed, and like many autistic people, they'll be super sensitive to the people around them. In my experience, if someone stays too close, then I'll be too worried about making the other person can feel concerned or even angry, and it makes it really difficult for me to wind down. So it may take a while for the person to be able to communicate with you verbally. It can take me at least an hour to be able to say much more than a word or two. And it can take longer for me to feel anywhere near comfortable or cognitive enough to describe or explain what happened, if in fact that's necessary at all. Generally, the only reason to revisit the situation is to tease out what led to it and use that information as knowledge of triggers in the future.